I'm going to focus my questions mostly on University Hospital, which I've done in the past and will continue to do. We have one public hospital in this state, which is University Hospital in Newark, which is our largest municipality in the state. It is in serious need of repairs and upgrades. After years of little to no investment, the building is outdated, it's falling apart. As we know, and it's a fact, that the emergency room was built for 50,000 patients. There are now, they see more than 100,000 patients per year in their emergency room. And as I said last year, and I'll say it again, and I'll keep saying it, we have grandmothers in the hall who are they have slots that are numbered in the hallway. Everyone doesn't get a cubicle. And we have grandmothers who are being forced to use bedpans in the hall next to prisoners where the police officers are holding the flashlights for the plastic surgeons to classify LA. I've talked to the plastic surgery residents. They do much of their work in the emergency room, and this is a big problem. Why is the funding for capital improvements at University Hospital being cut in half, being cut from $40 million to $20 million, despite these urgent infrastructure needs?
Thank you for focusing on safety net healthcare and safety net hospitals, as you always do, and for your advocacy for healthcare in general. I can comment on the parts of the budget for University Hospital that do come through the Department of Health. A lot of University Hospital's budget and those budget decisions are not under the department. I can say that, as I said in my opening remarks, we have charity care, we have GME funding that comes through the Department of Health, and it is so critical that we continue to focus on safety net healthcare. I can tell you that from the start of the Murphy administration and under the first year in FY19, University Hospital got about $83.5 million in subsidies through those programs that come through our department, and in the proposed FY26, it is $257.8 million. So significant increases in funding through the subsidies that do come through our department, and that is the support of the administration that has done that.
Well, that's over 7 years, and I just want to be clear that you've cut the funding for capital improvements in half in this budget, which, again, there's an urgency. My follow-up question to that is, so for the master facility plan, as we know, the hospital is getting ready to build a new doctor's office complex, an ambulatory care center. They are actively moving those trailers out of the parking lot, which have been used for facility use for, I know personally, people who are being forced to move their office space out of there, and they're dumping it in the building across the street, which is also a big, huge problem because, I've talked to the residents who are working and moving things over. However, that being said, last year, the state gave $45 million to start carrying out the hospital's long-term expansion plan, but in the new budget, no money is proposed, even though the hospital has asked for $55 million. This is on the master plan, but I'm going to follow up. I'm going to continue with this line of questioning before I ask you why we had that cut. As we know, and as I said last year, University Hospital has one working ultrasound at any time. We have two, but usually one is not working. Two, we have patients waiting in the emergency room for 48 hours. 48 hours sitting in the emergency room on a stretcher in a hallway, waiting simply for an ultrasound. An ultrasound is part of the master plan. We have rooms that are not large enough for our trauma facility. Trauma care, when it was built, they finally made an OR in the trauma center, but that room is not big enough for the equipment and the residents and the staff. We have anybody who's been in hospitals know that from 7 p.m. to 7 a.m. it is the residents who are doing all the care. They are because of a lack of personnel and equipment. It's the residents who are transferring the patients to ultrasound, which means that they're taking them away from the care of the patients. And there's not enough computers or infrastructure for all of this work that needs to be done. So why was the funding for University Hospital's master facility plan zeroed out? Because I think that most people can agree with one public hospital in the state that serves such a large number of people, we need a better facility to meet the needs for the people and for those who work at University Hospital.
Just want to say thank you again for your advocacy for the hospital, for safety net care, and for resident training. As someone who was a resident and had resident training at one time, it is critical, and so your attention on that is wonderful. Again, the capital budget that you're talking about doesn't come through the department, so I can't really comment on what that decision was. I can say that they have had...
Which department does that go through? Just so I can follow up with them.
It's Department of State.
State, okay.
So happy to have you do that. And the funding that does go through the department, I did mention, and happy to get you more information on that if you need it.
Okay, so let's go to the residents. As we know, every resident's salary is reimbursed through Medicare. So the same amount of Medicare reimbursement is the same across the nation, $180,000 per resident across the state. Why is it that University Hospital residents, on average, make less per hour than any other residents in the region? We passed a law, they can only work 40 hours a week, on average, over the month. That means that some weeks they're working 40 hours and some weeks they're working 120 hours. We did the statistics on this last year. They're making, on average, $21 an hour, which is less than we pay cleaning help at some facilities. And as we all know, as I just said, 7 p.m. to 7 a.m. But University Hospital and Rutgers program, so it's not just university, it's the RWJ program as well, they are paying less their annual salary is far less than other hospitals. And then they wonder why they're not able to fill all the slots. And they are not able to, and that means residency slots, because they do not pay them the same as they pay others. Follow up to that because I'm giving you a lot, but they also treat the residents as temporary workers, which means that they are considered temporary workers. And I would argue that every one of us here is a temporary worker. But they are, on average, committed to 3 years is the minimum amount to 9 years. 9 years are the neurosurgery residents, and their fellowships work for 9 years. They're not included in the pension plan, even though they're state employees. They get their salaries from the state. They don't have a contribution to their 401k. And then we say, why are the doctors not staying in the state? Well, I would say if you invested 9 years of investment into a pension plan, that you would incentivize a doctor to stay in the state of New Jersey and continue to work for the state. So that being said, can you tell me, I know you're going to say it's not your department, perhaps, but why are the residents at University Hospital being paid so much less than residents in other parts of the state, in the region? They're even paid less than Health and Hospitals Corporation in New York City.
Thank you for bringing that to everyone's attention and for your advocacy for residents. I hope I had a legislator who was advocating for residents when I was in residency at this level. I will agree that
I hear from them directly. They call me directly about their concerns.
It is not, the decision about residency pay or their GME program is not under the Department of Health.
Is that under Rutgers?
I would ask the University Hospital, and you could ask Rutgers.
Well, their paycheck comes from the state. So, okay.
And I can say that the GME supplements do come through the department, and that was part of those increases that I discussed. And there was a GME-T or GME trauma add-on that started in FY25 as well, and is continued and proposed in this budget.